the reason why I you maybe my child asks me for, say he needs money. The only reason why I say a second time is maybe the money you are asking for is too plenty. It's not that I did not hear you, I heard you, but yes, you say
Tell us how you got here. Tell us how you rose.
I want you to close your eyes and imagine your favorite sound. Maybe the sound of your parents or your spouse telling you how much they love you, or is the sound of your child singing your favorite song at the background. Now open your eyes and imagine that sound muffled, distorted, or even gone entirely. Not because of an accident or an ailment or any of those things, but because of what you do daily. You see, the World Health Organization estimated that about 2.5 billion people will experience hearing loss by 2050. In Nigeria alone, about 28 million people are experiencing one hearing impairment or the other. Now, you may be asking yourself, how come? Why are we having these large numbers? I'm going to tell you. Every time your ancestors took feathers and poked into their ears, they're enjoying it doing like this. The numbers keep getting high. Every time you take your cotton bud, you put into your ears, you push those things inside, the numbers continue to get high. Now, if you look at this, every time you use this and you put inside your ears and you increase the volume, high decibels, the numbers continue to get high. You stay around your generator, the numbers get high. You go to a nightclub and where you have the decibels at around 120. That's for those who check. And your ear probably need less, most likely need less. I think about 80 something anyway, 86. But his ear is going to explain all these things. Every time you do this, the numbers continue to get high. And you do this without even checking any ear doctor. You see, people do this and they don't ask any questions. Today we are going to be asking questions, but we'll be doing more than that. We'll be answering them. With me here in the studio is an ear doctor with over 22 years experience. Yeah, I got that. Over 22, 25 years experience. And he'll be explaining the truth about the dangerous things we do to our ears daily. Now, if you care about your ears, I want you to watch this video to the end. If you care about the ears of your loved ones, I want you to share this video to them. Many times we think the ear is just used for hearing alone. No. And sometimes we think because we can hear, our ears are healthy. No. You see, your ears is much, much more than that. You need it for balance. So sometimes when you stand up and you feel woozy, you can't, you stagger, it's not because of anything, it's because of your ears. You're not taking well care of your ears, they are degenerating. So it's possible for you to be hearing very well and your ears are degenerating. Anyway, I have someone in the studio and he'll be doing justice to this topic. I want to welcome our ear doctor. You're welcome, sir.
thank you, Kelechi.
Yeah, it's good to
Yes.
have you.
Yes, good to have
Yeah,
you.
I said something about 22 years experience. Well, it looks like I doctored some years.
Yes,
I did.
yeah, you doctored some years because I think 1997 will be how many years
That's a lot.
yes, that's a lot.
That's a lot.
So it's about that
That's a
time you
lot.
calculated. Yes. Yes.
That's a lot.
And during this period, I taught in at the National Eye Care Center for
Okay.
18 years.
Okay.
I've been running clinics, outreaches, going to places. I think I've been to all 36 states, and for the purpose of
This hearing thing.
hearing impairment
Yeah.
and solution to hearing impairment.
Yeah, coming to know you,
Yes.
I found out that you work hard a lot. I've been to your place.
Yes.
You know, and I look at the ear thing, apart from the fact that I'm of close proximity to you, I have access to you. But I noticed this staggering number where we have about 1.1 billion young people are experiencing hearing problem. And you know, when they say hearing problem, what exactly does it mean? Does it mean we can no longer hear? Or it means maybe the ear is affecting our cognitive functions and we can't function very well? What exactly does medical people like you mean when they say certain number of people are experiencing hearing problem? Because as far as I'm concerned, a lot of people can hear. But what exactly does it mean, sir?
When you talk about hearing problem,
Yes, sir.
you categorize them.
Oh,
You have mild, moderate, severe, profound hearing losses.
okay.
Now, there are persons that you need to raise your voice for them to hear you.
Yeah.
Let's start with whisper.
Okay.
You see somebody that has good hearing, he can hear whisper. You whisper and they are able to hear.
Yeah.
For those that have mild hearing loss, they don't hear whispers.
Mm.
You need maybe normal conversational voice. For those that have moderate hearing loss, they don't hear normal conversational voice. They hear raised voice.
Oh.
You have to raise your voice for them to hear. And for those who have severe hearing loss, they don't hear raised voice. You have to shout. So you use shouted voice. And then for those who have profound hearing loss, even the shouted voice, they don't hear. So these are the ones who call deaf.
Oh.
Yes. Somebody can be hard of hearing from mild, moderate, severe, can be hard of hearing. But when it comes to profound hearing loss, it is deafness.
Oh.
And when you want to define deafness, that profound hearing loss, that's last level of hearing that you are talking about.
Yeah.
It has to be in both ears. If one ear is having, say, moderate hearing loss or mild to moderate hearing loss, and the other ear is profound, the person is not deaf.
Okay.
So deafness means profound hearing loss in both ears.
Oh, okay. That's
Yes.
exactly what it is.
So when you say hearing problem, hard of hearing, you are talking about somebody that has not become totally deaf. Yes. But when you talk of deafness, you mean the person is not hearing at all from both ears.
Okay.
Yes.
Thank you very much for this. Is there anything we do every day that is affecting our ears generally?
You quoted some figures
Yeah.
a while ago, and I will attribute these figures globally to explosion in population. We are increasing in number.
Okay.
Nigeria is also has a peculiar case because we are also increasing in number.
Yes.
Yeah.
Yeah.
So, and with that, there are a lot of challenges. We do a lot of things every day that affects our hearing, and when chief of them, the key of them is technology has exposed us to a lot of things. And one of those things is we have our devices in our hands.
Yeah.
So these devices that we have in our hands, we are always with the devices, and we always want to listen to what comes out of the devices. At times, for privacy reason, we want to use earpiece so that it will be just personal.
So
because I will complain if your phone is disturbing me. I will say, can you reduce the volume? So for that reason, some people would prefer to use earpiece, and for that earpiece, because of the usage of that earpiece, because it is inserted in the ear, and because the volume is tuned very high, of course you expect hearing loss. Other lifestyle that we have adopted also affects our hearing, like clubbing.
Yeah.
A lot of young people go to club, and the music in the club is
Very loud.
very loud. When we were younger in Kaduna, we also experienced it. Go to nightclub, and then after coming out of the nightclub, you know that
Things have happened to your ears.
yes, things have happened to you. Then we don't even know the experience. I don't have this experience, but I cast my mind back now, go back to Kaduna, and I say, because when we come out of that nightclub, let's start with when you are in the nightclub. You'll be shouting at me, I'll be shouting at you. For you to hear me, for me to hear you, you have to scream into
your ears
while we're in the nightclub.
Exactly.
Yeah. And then also, by the time you come out of the nightclub, the next 5 minutes, We'll continue shouting.
Yeah.
We'll continue shouting because when we are at that nightclub, we have raised the threshold of our hearing temporarily.
Oh.
You have conditioned the brain to a level of sound temporarily. You know, so that is called temporal threshold shift. Threshold is, as we are in this room now, your ear has become used to the level of sound here. So much that if you go out and there is a loudspeaker, you'll be very uncomfortable.
Yeah.
As soon as you are entering the nightclub, it is intolerable. As you are entering the nightclub, the sound is intolerable. But with time, your ear begin to adjust. So it has shifted the threshold from where you are coming out to a place where the noise is so intolerable. But with time, he adopted. So as he adopted, he pushed your brain to accept this level of sound. But the damages are going on. The damages are already going on in the ear. And with time, with that kind of exposure, you begin to see people with various degree of hearing loss. The hearing loss is now beginning to introduce itself. That's why check the ear of musicians and you see that as they are on stage, just look as they are running about and dancing about, just look. They plugged something in their ear.
Yeah, something that will muffle the sound.
Yeah, it muffles
Like
and it controls.
you cancels.
Yeah,
It sound cancel, something like that.
yes,
Yeah.
yes. It muffles the sound. It brings. It controls the sound.
Okay.
Yes, we call it ear protector.
Oh, okay.
Yes,
Oh.
we call it ear protector because it protects the ear. That ear protector, you can get it for to protect your ear from sound, and also those who swim also that do not want water to get into their ear, they also get that protector. So, and it's right from the audiologist clinic that you take the person's ear impression and you make the ear protector exactly to the size of his ear or her ear, so that nothing harmful goes into the ear.
Yeah. Okay. I'm going to switch gears a little bit because you made mention of people swimming and what has gotten into their ears. There is this damning statistics that is not so good. They said one out of I think 126 people experiencing permanent ear damage as a result of water entering into their ears. There's a name they call it. Is it terminatis or something like that?
Otitis externa.
Yeah. So, what should someone do? Because you can't prevent water from entering your ears when you are swimming. Possibly you can, but if it goes in, when do you, in your own, experience, does it become threatening?
You know, anything that goes into the ear, except it is out of size or an object that wants to remain in the ear, by gravity, it should go out by itself, and it all depends on the size.
Okay.
Water is a liquid that
Yes.
if it goes into the ear, by the time you turn your ear for some time, by gravity, you feel some warmth and you see the
I've
water.
experienced that when I went
Yes,
swimming.
yes. So you feel that warmth and you know that, and then your ears become clear.
Yeah.
And you know that the water.
I love the sensation actually.
Yes, the sensation is cool.
Yeah.
That warmth.
Yeah.
Yes. So the water should be able to come out by itself. But for one reason or the other, maybe because there is wax in the ear,
Oh,
the water is retained.
okay.
If the water is retained, because this is a clear cavity that whatever goes in as liquid should be able to come out. Clear liquid should be able to come out like water. But when maybe something is holding the water back, that thing that is holding the water back can start an infection. But that infection will not cause damage to hearing because it's not in direct contact with the eardrum.
Okay.
What separates the outer ear
Mm.
from the middle ear is the eardrum.
Okay.
If you take a light and look into the ear, what you see is the eardrum. You don't see beyond the eardrum.
Okay.
So if water gets in, probably it gets to the eardrum, it will flow out. Except the water goes in by force
Okay.
and
High
perforates the
pressure.
eardrum.
Okay.
Yes, high pressure, and perforates the eardrum. Then infection will start in the middle ear.
Okay.
Otherwise, when water gets into the outer ear, it naturally flow out by gravity.
Okay. The outer ear, you mean the pinna here?
No, the outer ear, there's a cavity. You see the hole.
Okay.
After the pinna here,
Okay.
then you have this hole is part of the outer ear, and it stops at the eardrum, the tympanic membrane.
Okay.
Yes. So the tympanic membrane is the tympanic membrane is very thin and delicate.
Okay.
A little pressure
We
will
just
perforate.
perforate it.
And that's why we discourage the use of cotton bud, because as you are trying to clean your ear or whatever, cotton bud, any object you are bringing close to your ear, you may perforate the tympanic membrane. And for children, you are using cotton bud and they are protesting. You don't know the distance between where your cotton bud is reaching to the eardrum. So he come, I want to clean your ear. You're trying to force the child, you want to clean. Before you know it, you have perforated the eardrum and you see blood coming out of the ear. So that is why it is advisable not to use cotton bud or any.
Okay, so what
object.
should we use to clean our ear? Or the ears of our kids?
Yes. You know, the ear is self-cleansing. In the middle of the cells of the ear cavity, the hole you see in your ear, is produced at the center of the eardrum, the tympanic membrane, and it moves outward, and the cells. So new cells are being produced. Older cells are moving outward. As they are moving outward, they are whatever is in the ear also comes out with it by gravity. But in some people, the wax will be impacted. So they should not try to remove it themselves. If you are not hearing clearly, the first thing to do is to go to the hospital. We'll just look into the ear, and then we'll see that the wax is impacted. Now, this is how it works. I am an audiologist.
Okay.
You have the ENT department as a whole.
Okay.
So if a patient walks in, the ENT consultant sees the patient and then look into the ear. The patient has wax in his ear. Send them to the ENT nurse to have the wax removed. If there is hearing loss, if the patient complains of hearing loss, they send them to the audiology clinic, and then you trace what is the cause of this hearing loss. Or, okay, what is the possible cause of this hearing loss? What is the level of this loss? Then you know the next intervention to to carry out on the patient to restore the hearing. Removal of wax, instantly the patient will begin to hear.
Okay.
If fluid is trapped in the middle ear, okay, so the patient will be taken to the theater, and then a tube, grommet, will be inserted through the eardrum to drain out the fluid that is trapped in the middle ear.
What kind of fluid? Water?
Yeah, it's usually mucus.
Oh.
Yes, it's usually mucus that will be trapped in the middle ear. And what causes this condition most time is there's a tube that left the junction where the nose and the throat
connect.
and the ear
Oh,
connect.
so there's an
The ear.
intersection.
Yeah,
Okay.
there is an intersection. So there's this, they call it, it is called eustachian tube.
Okay.
So at the end of it, it opens to allow air into the middle ear,
Oh.
to aerate the middle ear. The middle ear is not supposed to have any fluid.
Oh.
Yes, because this is where the three tiny bones that conduct sounds are located. So it's no fluid, liquid fluid should be there, just air. So this tube open to allow air in and allow mucus that is lining the wall of the middle ear to drain out. Yeah. So if this fluid is trapped, maybe as a result of the tube not functioning properly, there's a need for minor surgery to inside that grommet for the tube to for the fluid to.
Come on.
And sometimes you find fluid in the middle ear as a result of the wrong way we blow our nose.
What?
If you have catarrh, for instance, and you pinch both nostril like this and you
Yes,
blow,
I've seen people.
and then the next thing you feel your ear is full.
Whoa.
Yes, most time when people have catarrh, they don't hear well. But when the catarrh clears, your hearing becomes clearer. Yeah, so it is mucus that goes in together in the middle ear. So and when we blow it wrongly, we push, instead of letting the mucus out, we push it back into the ear.
So what's the right way to
So
do
you blow one nostril
Okay.
after the other,
Okay.
and then you free the mucus,
Okay.
and the mucus.
Yeah, because I've seen someone when he wanted to sneeze, he held both nose and
Now you
Yeah.
push pressure back.
Oh.
Yes.
Okay.
So if you are blowing your nose, the best way to do it is one nostril after the other, so you don't put pressure and driving, instead of bringing the mucus out, you push it back in.
Oh.
And then when you push it down, you begin to see that your hearing has reduced. Sometimes if you swallow, you see a pop and your ear opens again.
Oh.
Yes.
Okay.
And it also happens if you are flying. If you are in the air, you feel some fullness in
Yes, I
your
was
ear.
heading to that.
Yeah, so when you swallow, pop, it opens. So that's the function of the eustachian tube, this tube that we mentioned, that regulates the pressure in the middle ear.
Okay, but you just said something about flying. So, and I think it's a result of air pressure.
Yes.
Something like that. But does it have any adverse effect on our ears?
No, it depends on how the eustachian tube functions. We're not even talking only about flying. If you have been to Jos before by road, if you are going to that hill, Hawan Kibu, as you are going to climbing now, once you are descending or ascending, that pressure is there. So it's not only by flying. It also happens when you are descending a hill or ascending a hill rapidly. There is this difference in atmospheric pressure that also reflects here, because the eustachian tube is trying to balance the pressure, the pressure in your ear with the pressure that is in the atmosphere. That's its function. It's trying to balance it. So we have instruments that, you cannot go beyond, you cannot go and see pressure in the middle ear. You cannot go and see condition in the middle ear. So we have an instrument called a tympanometer that as well tells us everything that is happening in the middle ear. It just opens your eye to, wow, so this is, okay, this person is not hearing well. Wow, okay, so this is the cause of the reason why the person is not hearing well. So you see the readings and you interpret them, and then you get the picture of what's happening in the middle.
Oh.
Yes.
Okay, thank you very much. I believe I've learned a lot so far. We're told the ear is self-cleansing. So don't put anything into your ears. Leave it alone. If you have wax, go to the hospital, see a specialist, and your ear will be cleansed. Thank you very much for that. I'm still coming back to this earpiece thing because it's technology, right? We live with it. Now, if you look at the shape of this one, you see, this is like normal, it's what we get there. But something happened thanks to 3D printing. So with 3D printers, there's something they do. They put wax into your ears. It- so the liquid, you just tilt your ears this way. The liquid will go into your ear. It will harden. So they bring it out, then it will harden. Now, when it hardens, there is an orifice like in between that will enable sound to get into your ear. So they will use this now to customize your earpiece. Yes, it's happening now as we speak, and it's quite expensive. So they will customize your earpiece, ensuring that the music you are listening to now, you will hear it inside. Maybe it's your third ear or your middle ear, the way you are explaining it. I don't know if it's your 10th ear, if there's anything like that. So it will just take the sound just in the middle. So what is the consequence of listening to music that way?
Yeah. First thing
Mm,
first, the only thing you should put inside your ear, the only thing that should go into your ear,
mm.
if anything should go into your ear at all, is your elbow.
Yeah, what?
Your elbow.
The
No, it's a common. That's the slogan in
elbow
the.
can't get it.
Yeah, okay, so
I
that's
said
the,
I can't do like this.
so that's the
Even if
common.
I'm a contortionist,
That
I
is
can't do like
that is
this.
the slogan in the ENT world, ENT audiology world. The only thing that should go.
You guys have an interesting session here.
Yeah, so the only thing that should go into your ear is your elbow.
Okay. So
Nothing at
meaning
all.
nothing should get into your ear.
Nothing should get into
So it
your
doesn't
ear.
mean the elbow
So
of your neighbor
yeah,
uh,
yes, even your neighbor's elbow
can't
cannot
even get into your
can't
ear.
even get
That's
into your ear. See, technology is driving us to a level where it is difficult to imagine the end, because what you are describing now is strange and shocking at the same time. I know we'll do this. We I just told you about doing this for swimmers as well as doing this for musicians. What we do is we take the ear impression,
okay.
we control carefully what goes into the ear first before we pump. The instrument we use in pushing the foam that will protect the eardrum from the material we are going to inject in has
Yeah.
light on it. So we carefully guide it before injecting the impression material. Now, for you to tell me that people will exput their ear and then a material will be injected material directly, because even for us, we cannot inject a a material that will take a 3D shape. We have to take the impression, bring the impression out,
Yeah.
cast the impression
Yeah.
outside the ear.
Yeah.
It is the cast
Yeah.
that represents the person ear.
Exactly.
That is where all the material will go into.
Exactly.
That this 3D you are talking about now.
Yes.
This is where the 3D goes.
Yes, sir.
But that the 3D itself is the one going into the ear. Maybe they will take the impression, bring it out and cast it.
Okay.
I doubt if they will venture into doing that direct.
Okay.
Direct injection of material into the ear.
Okay.
Because the eardrum will surely be affected if you do that.
Oh,
Mm.
okay.
Mm.
Okay.
Mm.
All right. Let's look at these numbers. Don't mind me. I'm a number person, right? And I just said something earlier about 28 million Nigerians having one hearing impairment or the other. Now, does it reflect in the number of people that visits you in your clinic? They just come in, people that will come in and say they want to have their ear checked. Or do we leave it until it gets to a certain point before we walk in? Do you see large number of people coming to have their ear checked?
I don't think people just walk in that I want to have a routine ear check.
Why is that?
Awareness.
Mm,
Those that do it is companies that take this as part of their safety measure, and it is required by law. If they don't do it, they are penalized. It is those that we see. And
do we have such companies in Nigeria?
yeah, we have such companies.
We
in
don't have the
Nigeria.
law.
We don't. We have the law.
Oh, we do?
Yes.
Oh,
We have safety laws that talks about protection at workplace.
okay.
But only a few persons
Adhere to it.
they adhere to it.
Hmm.
On the 5th of next month, we are going to Shiroro.
Okay.
Yeah. Because these people have a lot of big machine that generate electricity for us. And part of their safety measure is this. If you go to Shiroro Dam, you measure 140 decibel.
140 decibels.
Yes, with their big machines that are generating electricity.
Wow.
So they took this as a measure to protect the hearing of their staff. So every year, Shiroro Hydroelectricity will say, please come and check the hearing of our people. Only a few companies out of many. If you tell me that if supposing we have like 1,000 companies in Nigeria, we'll say only about one. Yes, only about one will come and say, please come and check the hearing of our people. Some of these companies, the personnel are exposed to loud level of noise because there's a production line, and with that production line is a lot of noise.
Oh.
So it is required by law that okay, since you have this level of noise, your workers should undergo this test every year. Some do it, some don't do it. So it is those that does it that we see.
Okay. Okay. Speaking of
But
noise,
individuals don't come.
Hmm?
No, there is no individual I have seen. I've not seen any individual that
in
say
your 25
yes,
years.
that say in my 25 years, I would say maybe I forgot along the line. In my 25 years, maybe I see maybe 10.
Wow.
Yes, that said, I just want to test my hearing. Even with all these adverts, with all this uh, public, this opportunity that we're given to speak to the public,
Yeah.
nobody walks in to say, I want to take this opportunity to check my hearing.
Okay. Now, there's this number that is also not good. And we're told that people wait 7 to 100 years. Sorry, 7 to 10 years after experiencing a discomfort in their ears before they have it checked. Compared to if you have malaria, for example, if you're feeling feverish, you just go and for medical checkup, and sometimes you just run maybe a routine checkup. And generally, even the routine checkup doesn't include the ears. From the general body checkup doesn't include the ears. So now, what is responsible for this, and what should people do, or what should people look out for, before having their ears checked? Maybe people don't just know this. So, what should they look out for before having their ears checked?
Most people are in denial. I will tell you a story.
Okay.
There's this person that I know.
Hmm.
So we got talking, and I told him, you have hearing loss. He said, no, he does not have hearing loss. He's hearing me well. I said, no, you have hearing loss. And your hearing loss has been for so long that I can hear it in your speech.
What?
Yeah, I don't need, for some persons, I don't even need to test you. Just as we are speaking, I know this individual has hearing loss. Because those frequencies that are missing in his ears are also missing in his speech.
Please, I want you to shed more light on this. No, you say you
Yes.
can pick it from.
I don't need to test some persons. As
Oh.
as I'm speaking with you, I say you have hearing loss.
Oh.
Because see, you speak the way you are speaking now because you can monitor your speech.
Okay.
You can articulate your speech. You can try to even deceive somebody, as change your voice as if you are not the one speaking. It's because you can monitor your speech. Once there is hearing loss, you have lost the ability to monitor your own speech.
Oh.
So you see your speech becomes slow.
Okay.
You know, somebody dragging words in a
Oh,
sentence or
yeah.
this. Yeah, you see, the speech is no longer clear,
Yeah.
and some S will be missing. G,
Oh.
yeah, that sound will be missing in their speech because they are not hearing the f and the s. It is
Hmm.
what the brain speak that
Hmm.
it produces now.
Yeah.
So if high frequency is missing in your hearing, the high
Hmm.
frequency will be missing in your speech. That is why
Oh.
if you don't hear, you don't speak.
Yeah.
If you don't hear, you don't speak. And it
Hmm.
is what you share that you
Hmm.
also produce.
Hmm.
So if high frequency sounds are missing in your ear, you don't hear high frequency sound like the f and the s. They will also be missing in your speech. So when that person is speaking, the f and the s will be missing. And you know this
Hmm.
person has high frequency hearing loss.
Oh.
And then when they are also dragging their speech from the way they talk, it is not well coordinated, or you know that this person has articulation problem because there is
Hearing
hearing
loss.
loss. Yes,
Oh.
yes.
Okay. So, but what should parents look out for in their kids for newborns now?
Let me not skip your question.
Okay.
What do we look at as adults? Because
Okay.
before we look at
Okay. Okay.
as
Okay. Okay. Hmm.
when you are in a room in a meeting and you struggle to hear. I mean, look at this person is talking and you nudge your neighbor. What did he just say?
Hmm.
There is hearing loss.
Oh.
And that is if it happens more frequently, because some people can reduce their voice while speaking.
Okay.
uh But in a room, everybody is comfortable hearing what this person is saying, and then you nudge, say, what did he say? And you repeatedly you keep saying, you know that there is hearing loss. If your family members walk into the room and you are watching television and they say, why is your television always loud? You
Oh.
are you see you alone in the
Hmm.
house, and they say this level of
Sound is
sound
too.
is too loud. How can you
Hmm.
tolerate this kind of level of
Hmm.
sound? But you are comfortable with it.
Hmm.
But as soon as anybody walks in,
The person is.
or while everybody is comfortable with the level of sound they are getting, you say, please increase the volume of that TV. Let me hear
Hmm.
clearly. You know certainly that there is
There's
a
a
problem.
problem. Hmm.
And when you tell people to repeat themselves often, and then you struggle, and the reason why I you maybe my child asks me for, say he needs money. The only reason why I say a second
Hmm.
time is
Hmm.
maybe the money you are asking for is too plenty. It's not that I did not hear you, I heard you, but
Once again, repeat yourself. What?
yes,
How?
you say you know, but when somebody keeps saying no, you know
Yeah,
this,
there's a
there's
problem.
there's a problem.
Oh,
Yeah,
okay.
so you look out for that,
Hmm.
especially in elderly people, because
Hmm.
from 50 years of age, you see people are already losing their hearing.
Hmm.
Yeah, especially on the high frequency of hearing. So, and if for elderly people, um, you see this problem more frequently
Hmm.
showing itself, and then you know that this uh, daddy or mommy is not hearing well. And if you come to children, I often tell parents that with a newborn baby, if children wants to wake your child, allow them to wake your child. It's
Hmm.
part of hearing test for your child.
Hmm.
Children are making noise around your child, and you say, no, go out, you are disturbing this child, you wake up. Allow them to wake him up.
Oh, okay.
Yes.
So that's
They
a
are helping you
test.
test the hearing of your child.
Yeah.
That's what you look out for. Okay, now, children are playing, this child did not wake up. The door bangs, this child did not wake up. With all the noise, everything around this child did not wake up. It's already telling you, it's raising a red flag
Hmm.
that
Something could be wrong with the
I
ear.
mean, this one is different. This one is
Hmm.
not, with little sound that children just wake up. Nothing shakes him, no matter the amount of sound. Nothing shakes him. So the only thing that will shake this child now is vibration. Maybe wind from rain came so heavily and banged the door so hard. The whole place will vibrate and the child will feel the vibration. That is tactile cue. So through vibration, the child is able to hear, feel the vibration, and not that the child heard.
Oh.
Yes, and that's how the deaf. If you go to school for the deaf and they say they have cultural day and they are dancing, they are
Yes, I've
not
been
dancing.
wondering.
No, they are not dancing to the music. They don't hear jack.
Okay.
They feel the vibration, and that is why you see the drumming then is very loud.
Okay, because it needs to
Yeah, it needs to. They
vibrate.
need to feel the vibration
Oh,
on their body.
okay. So
To
they
know
dance to
that
the vibration.
they dance to the vibration, not to the music.
Okay.
Yes, they don't dance to the music.
Oh.
Yes, they dance to vibration. So when a child, you feel this child by the age of 6 months, 9 months, is not babbling, ba ba, ma ma. These are absent. For children, the ba ba and ma ma may be there. For children that are hearing normally, after 9 months, they begin to add, some even before them begin to add water, uh, ga, other simple words.
Yeah.
But for a child that is hearing impaired, he stop at that ma
Oh.
and ba. So
Okay.
like every child will say ba and ma.
Hmm.
Yes, those that are having normal hearing will progress to adding some more words. But those that are hearing impaired do not progress to adding more words. So they stop.
Okay. There's something, a thought that just came into my mind now. That was about 4 or 5 years ago when I went to your clinic. I brought someone, and to your hospital, sorry, I brought someone, and I noticed, someone there. I don't want to put the whole picture, but it turned out that the child was autistic, not having hearing problem. And so when you were giving us that information, it was quite painful. I could see it in your face too. So at what point do it move from a normal hearing loss to autism?
Autism and hearing loss have different paths, different road they are following. The first time I finished from school, I made that mistake. There's a family in Gwagwalada that said their child is not hearing. It seems their child
Okay.
is not hearing. But when I was taking the history, I missed something. They said that he follow nursery rhymes.
Oh,
I missed that information.
okay.
But that he's not hearing. I follow the family uh, 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 suggestion that the
Okay.
child is not hearing.
Okay.
So because for him the test is specialized test. It's not too long that we started this specialized test for children. So the little test I could do, I said, okay, let's fit him with hearing aid. We fitted him with hearing aid. But much later, uh-uh, I went to do a follow up and I saw this. I went to the house and I saw he's watching cartoon and he's following the noise. And I was saying, what? He's following nursery rhyme. He's hearing. If he's not hearing, he will not follow this thing I'm telling you
Yeah.
like more than 20 years ago. If he's not hearing, there's no way he will follow this nursery rhyme. And I said, hold on, hold on. I now begin to think towards autism. It is because of this very child that I went back to University of Abuja and did 5 years reading educational psychology.
Whoa.
Because of this very child, I went back and did educational psychology. So I will understand
Yeah.
children. I want to understand children more. I read a lot of book on child psychology and to understand children more, and then educational placement and all of that, and how hearing loss will affect a child's hearing loss. I had to say, let me go and do educational psychology. Now, if you bring a child to the clinic, he is a child. You don't know exactly what the child problem is. Is it hearing loss? Is it autism? Is it attention deficit hyperactivity disorder? Is it, so what's the problem with this child? Why is he not hearing? You are presented with a blank slate.
Yeah.
So it's now up to you from history taking. You take your history down, and then after the history, you come to you test themselves. You test from the outer ear, middle ear, the nerves that connect the middle ear to the nerve that connect the inner ear to the brain, and then the brain itself. Is the brain receiving sound the way it should be receiving sound?
Oh, okay.
Are the nerves of hearing that connects from the inner ear to the brain, are they firing? The inner ear itself, the cochlea where you have the hair cells, are the hair cells in the inner ear functioning properly? So you have to trace one step by step by step to know where the problem is. So if you now know, if you now see the problem, you now see that, okay, no, from history, you now know, no, this is not hearing loss, this is autism. From your test, you now see, this is not autism, this is hearing loss. From your test now, no, this is not hearing loss, this is not autism, this is attention deficit hyperactivity disorder. You see, very active, extremely active children. They are hearing. They are hearing, but they don't have that. They don't. Their attention span is very little.
Yes.
Okay. Their attention span is very little. So we also put all of this into consideration. And there are those that you've done everything. They are hearing the sound, but they don't understand speech. There's a difference between hearing sound and understanding speech. All speeches are sound, but not all sounds as speeches can go into speech.
Can you elaborate?
Okay. If you look at how we hear in our ear, there is the speech frequency in the middle.
Okay.
But the ear can pick all sound, but the speech frequency is restricted in the middle.
Okay.
And it has a level also. So the speech, I will call it speech spectrum.
Okay.
So it has upper limit for decibel, for loudness, and it has limit for the frequencies.
Okay, is it like a sinusoidal?
Yeah, no, it's not sinusoidal. That one is this. You are talking about waves.
Okay.
Waves travel through that speech spectrum.
Okay. Yeah.
Yes. So it's just like a map.
Okay.
Speech map.
Okay.
Yes.
Yeah.
So that's what it looks like. Yes. So that's where our speech falls in. There are some people now that have very good hearing. And their hearing is excellent. If you drop this now, they hear it. But when you talk, the speech, the actual speech is not there, despite the fact that they have good hearing. But the speech is not there. So where is the problem coming from? It's coming from the brain. Yes. So you as an audiologist, you now look at, you are being very careful between, especially when fitting hearing aids, between a patient hearing sound and a person understanding speech. Apart from that, you also look speech, music, and all of that to quality sound, not just sound, quality sound. That is what you are looking for the patient that is seated before you. Yeah, so you now, through your test and through your history, through you arrive to arrive at this diagnosis for whether you are dealing with a patient that is having delayed speech. Some children will just delayed speech. And with those ones that delay speech, you don't go into fitting hearing aid. You are damaging what you need is a speech therapist that will help him to bring out the speech. You don't go into fitting hearing aid because it's delayed speech. Because you have done all your tests now. The test tells you that from the outer middle inner ear nerves of hearing to the brain, everything is perfect, and you check from the history is not autism, you're not fitting hearing aid, you recommend a speech therapist.
Okay.
Yes. If it is maybe uh, some children may need a psychiatrist, some will need a psychologist, and some will need speech therapist. So you just recognize the next specialist that will you refer this patient to
Okay.
to help solve the problem. So it's an area that yes you need to be very cautious and careful so that you don't give wrong diagnosis. I did a test recently and someone called me from from the US that okay yeah they saw my test, yeah, wonderful, they are thinking this, they are thinking that. I say yes, I will not fit that child with. He said this child has um level of hearing that requires hearing aid, and they said if it is there in the US they will have fitted the child with hearing aid. I say yes, professor, I totally agree with you. Yes, now he's professor of ENT. So I tell him, yes,
I'm
professor.
sensing a form of sarcasm.
No, yes, professor. No, professor, I totally agree with you. But just look at the angle I'm coming from. This child has middle ear problem, and a tube has been grommet has been inserted in the through the eardrum to drain out the fluid. I can't fit a child that is having middle ear problem with a hearing aid, even if the level of loss. He has mild hearing loss. It's not that the hearing loss is moderate or severe. He has mild hearing loss, and you are saying, okay, because of that level of loss, I agree with you. If it were maybe like inner ear problem, yes, but this is we are dealing with a middle ear problem. Allow the procedure that has been performed for relieving the middle ear to take its course. The grommet that was inserted will fall off by itself. Allow the ear to heal.
Yeah.
That hole they
inserted,
they inserted that grommet.
Yeah.
Allow it to heal now, because when there is a hole in the ear, you have lost 40 dB of hearing.
Oh.
Once an ear there's a perforation in the ear, that patient has lost 40 dB of hearing. So I will not be, I say, Prof, I will not be in a hurry to fit hearing aid on that child because there's still perforation in the ear. But he is insisting, no, his level put, I say, okay, fine. You see, it's what you want. You guys are in the US, you know better than us.
You don't.
No, that was you want. I will do it. Thank God the parents want it. So it's not that out of my and my say I sat down and decided on that. And this is what I do. Even if a patient walks into my clinic and they want to see me and I've finished everything I want to do with the patient, I send the patient to another clinic or hospital to have a second opinion. I don't finish with the patient and say, okay, I'm done with you. This is what I would. I say, no, this is what I done. This is my own
Prognosis.
yeah, this is my own conclusion.
Yeah, okay.
Please go to another place. I will refer them. Go to this person, go to this place, or go to this place. There are 3 places, make your choice. Go and have a second opinion to what
Yes, sir.
I have done.
Oh,
Yes.
okay. Is Nigeria too noisy? Before you respond to this, I have to explain why I'm asking this question. You see, we lose annually, the world lose about $980 billion to one hearing problem or the other. And if you go to certain places, you see how noisy they are. So it makes me think, why are we not looking at this hearing thing as a very big problem, as an economic problem? So coming back now to this question, is Nigeria too noisy? And if it is, how is it affecting us economically?
Yeah, Nigeria, it depends on the city you find yourself.
Lagos.
Lagos, I would say Lagos is noisy, Kano is noisy, the traffic, the horn, all the blast.
The way you are doing your face, I
I,
can
I
imagine
dey go
how
Lagos
noisy
now.
noise.
I go to Lagos now and I see the noise pollution, and it's kind of not very good. But if you say generally, if we generalize it, uh, it will be not it will not be too accurate. Let's say some Nigerian cities. If you go to some Nigerian cities, they are really loud. Abuja is also becoming loud. And what is worrisome is our religious places of worship. They are
That's
making
true.
the matters not too good.
Yeah, both
Yeah.
both major religion,
Yes, that yeah.
obviously. I
Yes,
agree with
they are
you.
making
Mm.
it's not the loudspeakers are now they are forcing us to hear them whether you don't want to hear or you want
That's
to hear.
true.
Uh-huh.
Whether you want to go to church or you want to go to mosque,
My
you are forced to
there's
listen.
this
Yeah.
person that preaches in every morning. The speaker, my house is far away from the speaker, but every morning you must hear her preach. So if we want to regulate this, we'll say, hey, all of you, it's either you turn your speaker into your church, direct it into your premises,
Yeah.
or let it face the sky.
Mm.
Don't put it to face the population.
But they are targeting the population
No, but let it
because they're not preaching to the birds.
let's give the preaching to the birds and combat the birds. Yes,
Oh, okay.
yes, it is really loud, especially when it comes to our religious institution. You go
Yes.
to the market, it's still the same
Mm.
noise everywhere.
Mm.
People playing music, loud music to attract people. We've talked
Mm.
about the entertainment places. You come,
Yeah.
you go to clubs, you go to gardens, you go the
Mm.
noises. Me, if I want to come to your garden, once I see that the noise is there, uh I'm not, that I'm not
Yeah,
coming.
obviously.
So um because I'm aware,
Yes.
I stay away from noise as much as I can. As much as I can, I stay away from noise.
Yes, and I also believe that being very close to you made me to also be very much aware of noise around my area.
Yes.
And if you're listening to this podcast and you're conscious of it, you also will be very aware of noise around the place you stay. Now, speaking of this noise, we are talking about what is a safe. I've had this, and they said, okay, about 86 decibels is the safe noise or sound out there. So we know that there are certain places like with generators, they do about 105, 110, depending on how bad the generator is. Now you go to club, they are doing maybe 120, 130. These are places, same countries that measure these things. But are we what is safe out there, so it doesn't look like, I don't know what I'm probably don't know what I'm talking about, but what do you consider safe out there, the safe sound? Is it like the obviously everywhere can't be like here, this place is quite quiet, but what is safe, what is a safe place? Because our schools too is becoming affected. There are public schools you go to and you see the noise. I'm not talking about campuses now, secondary schools, primary schools, you see the noise. So what is safe out there? And what is the effect of this noise over 5 years, 10 years period of time?
If you go to your Android phone,
Okay.
Play Store, download sound level meter.
Oh, okay.
I have
Okay.
sound level meter in my on my phone, so
Okay.
and it's accurate.
Oh, okay.
So it tells you the level of sound wherever you are. It tells you in this place that you are sitting down now,
Yeah.
this is the level of noise, the sound noise
Oh.
in that environment.
Hmm.
So if you talk about safe, how do you measure safe sound in that people listen to, because there is no display of, okay, this is the level in this particular place, this is the level in this particular place. What I would rather advise is, for those that are directly exposed to noise, like those that are grinding engine in the morning, they want to grind. For those that are doing akara, they want to
Yeah.
grind. For those that are doing
Yeah.
and then the
Yeah.
welder that is doing his welding, and then if
Exactly.
that sharp sound, the fire
I
coming out
can't
and
even
all,
stand it. Yeah.
and the carpenter that is hitting the nail and all of that.
Hmm.
Check all of these people. They have already hearing loss.
Oh, they have
They
already.
have check them. They all have hearing
So,
loss.
what advice do you have for a welder?
No, the protection.
Oh,
Because if you say you want to do, advise the general public is, stay away from loud sound as much as you can. If you are in the church, stay away from where they kept those big speakers.
honestly.
If you are There was one day I was at area 3, and it was a program, and the only space available is in front of a speaker.
Hmm.
With all my knowledge, I say this program will not miss it. If this
Hmm.
speaker, say, for 2 weeks, I had pains in my ear because of I was sitting next to the speaker. I know the dangers, I know the exposure, but I say, when the program ended, I say, oh yes, so you want to go to heaven, say? Okay, so yeah, it's no problem. You deaf from here and then go to heaven. Deaf from here
Yeah.
and go to heaven.
Yeah.
Eh, go and do it next time. I told myself, go, this foolishness that you did back, go and do it next time.
Hmm.
Because you can, once you see where there is loud, because some you can't control it. Can you control the horn in Lagos, the whole traffic in Lagos? Tell them,
No.
don't blare your horn, don't. So as much as you can, there are some ear muff, that tiny things that you can just use to plug your ear, where you know that the sound is excessive.
Yeah.
I mean, normal sound like car passing, people talking in the market, except for that loudspeaker. I think it's unacceptable. You can measure 80 decibel, 70 decibel, 80 decibel, 90 decibel from those environments, which I don't think is much. And it's not that you are staying too long in those environments. If it were that you are staying in the market for a very long time, it becomes a problem. If it's that the generator you are staying with, you are staying with it for a longer 6 7 hours, and then, so we come back to occupational hazards. Those that are exposed to very loud level of sound as a result of their work, because they need to survive doing that work. Those are the ones I think we should not focus on and say, get protected. Like, this is occupational hazard. This is what they do every day. You that is exposed to sound in the market, in the church, and it's not every day.
No.
But these ones are every day.
Yeah.
So we rather focus on those that are exposed every day, because that's their means of survival. They are there every day. So we look for safety measures and find ways to.
Yeah. So you heard that you need to protect your ears. If you're a welder, a carpenter, and then
Grind
maybe you have a
engine.
shop in the market, you grind this engine, any of this occupation, okay, you work in a nightclub, maybe as a DJ, waiter, any of those things. So ensure you protect your ears. Get something to protect your ears. Okay, there is this thing you said. You talk about an intersection, okay, between the nose, then the nerve sending it to the brain, the ears, the mouth, things like that. I don't know. And there is this study by John Hopkins, and they said that people with even mild hearing loss, it doubles the risk of dementia and things like that. So the question now is this: what's the connection between the ear and the brain? I know you gloss over it, but can you really elaborate on it? The connection between the ear and the brain.
Yeah, we We represent a hearing aid company. I represent a hearing aid company
Okay.
in an international hearing aid manufacturer. I represent them in Nigeria.
Okay.
And the recent hearing aid they produced with dementia in mind.
Oh.
They say deep sensor, deep sensory hearing aid.
Okay.
They want the hearing aid not only restrict to your hearing, but let it also affect your brain as it functions.
Okay.
You see, our brain is active like all of the time, and it needs all these inputs from our sense organ, the eye, the ear, the tongue, the skin. All of this gives input to the brain, and hearing is key
Yeah.
to those input. Okay, they're talking about they run the risk. They don't say not hearing properly will cause dementia,
Yeah.
but it's at
Double the
risk,
risk, yes.
double the risk
Yes.
of dementia.
Yes.
So to avoid dementia, makes your make it's good for your hearing to
Yeah.
be
Yes. Top notch. Yeah.
top notch.
Yeah.
Yes, because most of the information you get in your life is by hearing. I teach in Kaduna, and always when I'm with my students, before the first day I'm entering the class for that semester, I say, hey, all of you sit down. If you have to choose between deafness and blindness, which one will you choose? Of course, you know. The students will say, they will do that. How can I not see where I'm going? I no, they would prefer to be deaf than blind. But then you look at it, even if you are sleeping at night, your ears is what is telling you what is happening around your environment, because your eyes are closed, your tongue is shut, the skin is shut.
I've never looked.
No, you will not look at it. We have been in it for long.
Yeah.
Everywhere is shut, the ears alone
Very active. Yeah.
is very active. Your skin has gone to sleep, your tongue has gone to sleep, the eye is gone to sleep, everywhere is gone to sleep, but the ear does not shut.
Wow.
It is there 247. Working 247. And that is why in your sleep somebody will knock and you are able to.
Yeah.
In your environment they are shouting, hey. In the night you are able to, because the information came only through your ears, not through your eyes or any other organ. So it's very important that you have good hearing in old age. And that's why we keep advising people, don't sit down until they say you are hearing impaired before you carry out this routine check.
How often should we, can you give us a timeline?
Yeah, let's say once a year.
Okay.
At least once a year. Some people want to do, if you are suspecting, you can do twice a year to monitor it. Like me, I monitor my hearing, not because the equipment are available. I just sit down and check the ear and see what's happening. Not because of that. I noticed that because I drive, and the wind from my left, the wind blows my ear as I drive when the glass is down. I travel a lot.
Yeah, I know.
So I now discovered that, this ear is always exposed. Now, it is this ear that hears the sound from trailer.
Yeah.
It is this same ear that hears shouting from when I'm driving. It is this same blare from car horns and every ear, because the right hand side is far from the window here.
Yes.
And I discovered that the high frequency in my left ear has dropped.
Oh.
Yeah. Because all the sounds that I hear from the outside are all high frequency sound. It dropped a little. So because of that little drop, I say, my guy, monitor this ear.
Whoa.
Monitor this ear before.
I just want to imagine a driver, they do it 247.
Yes, they do it 247. Check all these drivers, the side that is exposed, check it and see. I took myself as an example. So
and
I
you don't
checked.
even you don't travel 1/10 as much as your normal drivers.
Yes, as the normal drivers, they are always on the road.
How bad.
Yeah, so the horn is on that side, people, everything, the whole noises. So I take my time to say, so like every 3 months I'll check it. I say, it's where it is.
Oh,
So do I take a measure by putting a muff in my ear as I drive? That's the question I ask me. So when I want to drive now, I plug something in my ear. So the wind that it doesn't stop me from hearing horn from behind and all of that. This ear is open. This one that is exposed. Let me plug something.
wow. Okay.
Yes.
You see, okay. I'll see ask you a question that is related, that is brain related. In basic biology, we're taught that the ear is used for balance. What is that?
Hmm. You see, the ear is the organ for balance and hearing. So an audiologist not only do findings on hearing, he also does finding on balance. What is causing this person to lose his balance? So in the inner ear, the organ of hearing and balance are brothers and sisters. They are joined together and have like the same duct and fluid flowing through them. And while the organ of hearing has the cochlea, the organ of balance has the vestibule. You see the three semicircular canal.
Okay.
Okay, these three semicircular canal are so angled. They took three different angles to know your position in space. So it is the fluid that in the is traveling in the semicircular canals that helps to send a message to the brain that this is your position in space. So the the organ of balance is also very, very, very sensitive. The fluid that is traveling through the organ for balance, if it is overproduced by a drop, the patient has balance problem.
Wow.
And if, because it drains out, if it does not drain out as the rate as it should drain out and there's retention, the patient still has balance problem. If you overstimulate it and that's if it is overproduced or not drained, the patient will have problem because I'll give you a typical example.
Okay.
When we're children,
Yeah.
you stretch your hand wide open and you start turning,
Yeah.
turning. As soon as you stop, you are going down.
Yeah.
Okay. You have overstimulated the you have over moved the fluid in the inner ear, in the organ of balance. You have moved it so far, and then by the time you stop, you stop, you lost your balance because you have overstimulated. You have overmoved the fluid in the in the inner ear for the organ. So audiologists have different way of measuring, um, uh, taking measurement for balance problem. Is the role of the audiologist. Nobody.
Okay.
Yes, it's the audiologist that measured for hearing, and it is the audiologist that measures for balance. So if they say there is a balance problem, you go to the ENT. The ENT refers to the audiology, and the audiology determines the cause of why this patient has this balance problem. Yes.
Okay. Yeah, I never thought that innocent thing we did that.
You are stimulating that innocent thing.
But
It is the inner ear problem. You are going to look for the trouble of the inner ear.
oh,
That thing
but,
that we are doing as children.
yeah,
Yes.
but it doesn't have any long term.
No. It has no long. Na play now.
Okay.
No be play. Una play am for 5 minutes. Everybody no. For even 1 minute, everybody don't go out.
Yeah, but I noticed that it does it increase with adults as we age.
Yeah, with adult, anything could trigger this balance problem. Like I told you, overproduction of the fluid, endolymph, um, or lack of drainage of that fluid. So, and it could be as a result of some drugs could trigger it, and then when the effect of the drug wears off, it goes. There's a when we're young and we're in Kaduna, going to
Mm.
clubs and all of that. There's a level you will shark. The boys, not boys, boys will shark. They will say, that's why I say some drugs you take will affect.
Yeah.
Some people will drink and they say, hold me, the room is turning, the house is.
Yeah.
You've heard it before.
Yeah.
Somebody drank so much and he says
Yeah.
the whole room is turning with him.
Yeah.
Yes.
Mm.
So it's part of just the,
It's
yeah,
crazy, man.
stimulating. You took so much that is affecting the how your balance is. So
Oh.
so there are certain things we take, and there are some social behaviors that will lead to having this balance problem.
Okay, let's talk about hearing aids now. At what points do you see someone and after your own diagnosis, you find out that this person needs a hearing aid? But that's not even the main question. The main question is when also fixing the hearing aid. You said something about it becoming damaging to the ears. Can you shed more light on that?
When
Mm.
someone has mild hearing loss, he needs hearing aid.
Okay.
Once there's hearing loss,
Okay.
he needs hearing aid. When the hearing loss has become so profound
Mm.
that hearing aid cannot solve this problem, we
Mm.
start talking about cochlear implant.
Oh,
Yeah.
okay.
Hearing aid can no longer help this person because this person has lost like 95% of hearing. What is left in the ear is only 9%, only 5% or 10%, 5% of hearing. I'm not using decibels. I'm only using
Yes,
percentage
yes,
because of people
the,
to understand.
yes,
Now
yes.
you start thinking of
Mm,
this person should get a cochlear implant
mm, okay,
instead of the hearing aid.
okay.
The last question you asked,
Yes, at what point you said that if somebody hears like I'm hearing well, I don't need hearing aid, and I put on maybe hearing aid, you say it could be damaging to the ears.
yeah, because
Okay.
what damages one of what damages hearing
Mm,
and what it damages is the hair cells in the cochlea in the inner ear is sound. If you have no need for sound, you don't have to put excess sound in the
sound
ear.
okay because that would be like you're increasing the
You are
sound.
increasing,
Oh,
yes. If
okay,
that's exposure, and
okay.
that is why when we are fitting hearing aid, we fit digital programmable hearing aids.
Oh,
That is why we say you don't just go pick hearing aid from the shelf, off the
mm,
shelf. You see hearing aid on the internet, you say they say it's hearing aid, you go and pick. Some of these hearing aids are amplifiers. You cannot
mm,
program them, and some of the amplifiers are they say they are also programmable. So to get a hearing aid, you need to go to a clinic and have your hearing test done. The hearing test will determine the hearing aid that will be selected for you.
yeah.
There are hearing aids for mild loss, moderate loss, severe loss, and profound losses. So that test that is did, that level of hearing that they have found out, they'll pick this level of hearing, put it in the system, and the system will configure it and
Mm,
deliver the exact amount of sound that your ear needs, not more, not less.
mm,
And hearing aid has been so sophisticated now that even some hearing aids are able to translate languages for you, like 80 languages. You go
mm,
to a country, the hearing aid, all you need is just transcribe. As the people, somebody is talking to you, your hearing aid is speaking it, it is being transcribed.
mm,
So hearing aid has become so sophisticated. And so people should not say, "Like, I want to manage hearing." If you there's a level you want to manage hearing aid, and
mm.
what you get is total damage to the hearing.
Oh,
Yes.
so
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 as good as hearing aid is, can cause hearing loss.
wow.
Yes, if it's not properly fitted. Yes,
Oh,
this is hearing aid. Good digital programmable hearing aid. If it's not properly fitted, it will worsen the condition of the patient. It will make the
mm,
hearing loss worse than when the person got the hearing aid.
oh. Okay. Now I know the reason behind. There was a time I brought somebody to you, So I wanted to wait, and I was just saying you ran so many tests, check this one, check one hearing aid, you fitted another, and I had a meeting. I was just wondering, hurry up, hurry up, hurry up. Of course, we are elderly, I couldn't tell you. So now I understand the science behind it, the reason behind it. You know, if you fix a wrong one, you
It will damage the
you
hearing.
damage it. Yeah. Okay, speaking about this damage, uh, it affecting the ears. I heard something, I read something that most part of the ears, the cells there regenerates, but there's a part that doesn't. I think it is the cochlea or
The,
something
the
like that.
cochlea,
The cochlea
the hair cells in the cochlea.
doesn't.
It,
And what was the consequence of it not regenerating?
it is numbered at birth. The exact
Oh,
number as it
okay.
is at birth, that's the number it is. It does not add more. It does not. It knocks off.
Oh, it,
As when they give birth to a child, the number of the hair cells in the cochlea, that's how. That's the number that remains there.
oh,
It don't. It don't add. It doesn't grow more.
okay.
So if it falls off, it is gone. So what
Hmm.
damages it? Loud sound
Oh,
can damage the
cochlea. The
those hair cells.
cells. Oh,
Drugs can
people who
damage.
abuse or normal
No,
over the
normal,
counter
you go to
medication.
the hospital, they are treating you, and then all of a sudden, yeah,
Hmm.
some people come back from the hospital, they are not hearing again. Some, they just as simple as malaria. Some malaria typhoid treatment, they are not hearing again. So many.
Oh,
Yeah,
I've heard something.
yeah, so
Someone said,
many.
okay, they lost their ear or a
Yeah,
certain percentage
yeah.
after taking normal
Yeah,
malaria.
some totally the ear is gone, and then there's noise in the ear, tinnitus.
Hmm.
It will leave noise in the ear, and then the person is not able to hear again. So, um, yes, the hair cells are very delicate. So, and then trauma to the ear, slap to the ear,
Hmm.
can cause so much pressure and sound to enter the ear and damage the hair cells in the inner ear.
Oh, okay.
Yes.
So, so it brings us to the same thing we've been saying: protect your ears, wear anything that will muffle the sound, so the ears are not damaged. So the cochlea, you called it. Okay. So now let's look at the career thing, so I don't forget. If I want to be like you, if somebody that is watching us want to be like you, what are the steps they should take? What should they study? What are the temperament? What should they be interested in before they can be an audiologist like you?
You read sciences.
Okay.
Biology is a science
Yeah.
subject,
Mm.
and then there are a lot of parts to audiology.
Okay.
Yeah, there's clinical audiology, there's educational audiology.
Okay.
Okay, uh, clinical audiologists. Um, I think it is for the first time in Nigeria now
Mm.
that in the Nigerian universities are now including audiology in their studies, in
Okay.
their curriculum, in
Okay.
their. You go to JAMB brochure and you see audiology. I think the most recent now that will be graduating students soon are Federal University in Azare and
Mm.
Federal University in Osogbo.
Okay.
Yeah, so these are the universities that will soon be graduating students. And then you also have those who have read uh, in medicine, they become doctors and they have interest in audiology, and then they go to audiology. And then there are also those who are ENT consultants who will do post fellowship diploma in audiology. We also have this training for audiology technicians
Mm.
at the National Ear Care Center in Kaduna.
Mm.
Yes, so they train a lot of audiology technicians already that have finished from the National Ear Care Center in Kaduna. And there are, like I mentioned, like four parts now. You read medicine, you have interest in audiology, you do ENT. If you are a fellow, you do diploma in audiology. That one is just recent in Nigeria. And then you have the two universities that are offering degree in audiology, and then you have the diploma in audiology at the National Ear Care Center in Kaduna. But the basic thing is the requirement is science students.
Oh, okay. So basically,
Yeah.
science students.
Yeah,
Okay.
science students.
Yeah. So let's look at nutrition. There is this popular belief that beans, leafy foods or something like that, they they claim that okay, it nourishes the ears and fortifies it. Is there a clinical uh, proof to that? That these things
There are
they
a lot
do,
of things in on the internet now
they
that
are not
you,
true.
yeah, you, you read them and you wonder, eh, what is this? How it
The
is?
relationship
The
between
relationship between, yeah, but there's something I did many years ago that,
okay.
yeah, it was unique, and I
Mm,
keep reflecting upon it. I've not mentioned it anywhere. It's not.
okay.
It's something I did.
Oh, okay.
Yeah, and I just thought maybe it's worth mentioning.
Uh,
A patient came, and it was like 3 days after she took drugs,
mm,
and she started hearing noise in her ear, very loud
mm,
noise, and nothing came, because if I've seen where so many people have gone trying to get rid of this noise in the ear, tinnitus, or there's nothing that have not been done.
mm,
No result. The noise is there.
mm,
So, but I now ask myself, I say, but this person just took this drug like 2 days ago, and she's coming the third day.
yeah.
The drug is still in her system. Okay, do I say, okay, she should take a lot of watermelon to help see if, because this thing is just recent, and the watermelon will help calm the effect of the drug she has taken, and surprisingly it worked.
So I believe you didn't just bring out the watermelon from your off your heart like
No, it
that.
just came from my head. It just came.
No science
No,
behind
no
it.
science behind it. No, I'm only saying some nutrition that they talk about, some work
Yeah.
for some, it doesn't work for others.
Okay.
That's the way I
Okay.
look at it. But
Mm,
if there is a research that has proven that over time
mm,
this thing worked,
okay.
it is worked, that this nutrition actually
Mm,
worked for this people, this group of people that participated in the research.
mm,
It did actually work for them. Yeah, then it is worth following. I only give this example with watermelon
yeah.
to say that what may work for you may not work for me.
Okay. I get you.
You may get another patient, you give him
Mm.
that watermelon, the ear become worse. It become worse. You say this watermelon has damaged my ear. So certain things will work for you, it will not work for
Yes,
me. So
that's true.
when you talk about nutrition, me, when it comes to nutrition, I just tell people eat moderately. Some
Mm,
people that, even you saw me like 3 years ago, I
yeah.
was bigger than this, and
Yeah.
yeah.
That's
So I just told myself eat once a day.
oh.
But that once a day, eat anything that comes to your mind.
Okay.
It's only once a day now I'm eating.
Yeah. You
So
should.
I cannot say, okay, I'm eating once a day, so I will remove this. I will remove.
Mm,
Eat once a day. Eat
yeah.
anything that comes to you.
Everything.
Once it just comes to your mind,
It is.
eat.
Yeah.
But it's once a day.
Yes.
It's not that, and I don't eat between meals.
Oh yeah. I'm like that too.
It's not between meal. I just take this food a day. Anything when I want jam, I will jam them
Yeah.
together. It's
You
once a
understand
day.
that? Yeah.
Yeah.
Yeah, that's true.
Yeah.
Because you see, what we are doing in this segment, we are looking at the myths and so many things like that. So we are busting the myths. Another thing I want to ask is smokers. People who smoke, does it affect hearing too?
The I have not seen a study
Okay.
that relates smoking
Uh,
to hearing loss.
okay.
But don't stress the body. I
Uh,
know, don't stress the body. Smoking will stress the body.
uh,
And if you there's there has been a lot of study that linked stress in the body to hearing loss. Yeah, because um, what's the name of this hormone that is in the body that restrict the flow of blood to the ear, and then noise tinnitus. The person will start hearing abnormal noise in the ear. Certainly, that means the ear is being affected by stress. So, if you smoke, you drink, these are part of what will, or rather, may contribute to risk factor
Okay.
to hearing
Okay.
loss.
Yes.
Yes.
Okay, so fine. We are pulling the curtain
Mm.
on this segment. I know this will not be the last time we are going to be having you. I enjoyed every second of this conversation. What are your parting shots you want to leave with our audience?
Mm. Um, just be good to yourself. Be good to yourself. What you know will harm your health generally, not just your hearing. You stay away from them as much as you can. But this is very special because I've seen a lot of that cases. If you are taking any drugs and you start hearing noise in your ear, please call the attention of your doctor, your nurse. Tell them that you're hearing noise in your ear. They will change the drugs for you, or they will reduce the dosage of the drugs for you. It's very important that as you are taking drugs and you start hearing noise,
Don't ignore.
don't ignore that noise. It's very important because for your ear to get totally damaged, at times it starts with that noise. And once the noise is there, so the noise is very difficult to manage. Once it has come in most people, it has come. It's not going anywhere. There's nothing you do. So they say tinnitus device. You use tinnitus device. When you are using it, you don't hear the noise. As soon as you remove it, the noise is there, and keep going to the hospital to have this noise stopped. If you are lucky, it will stop. If you are not lucky, the noise stays with you, and it's very discomforting. You not even pray for your enemy to have that noise in the ear. So whenever you are taking any drugs and you start hearing noise in your ear, please call the attention of your doctor to have the medication reviewed. Either they totally change it to another drugs or that dosage is brought down.
Thank you very much. Thank you so much. We appreciate your presence and do not ignore the noise. And that is what he's leaving us with. I also want to leave you with this. There's a 60-60 rule when it comes to hearing your devices. Okay. If you are using your device, you're using your plug, you can listen to it not more than 60%. The volume should not be more than 60%, and you shouldn't listen to it for more than 60 minutes. That's your 60-60 rule. And hopefully, we are going to have him again, and we'll be looking at medications with respect to hearing loss, the noise, and things like that. I want to thank you so much for your time. I wanted to share this video so your loved ones will hear this, and it may be the best thing they've had for a long time. My name is Kelechi Kocha. Until we meet again, see you next time. Bye.